Hi, Doc.
Hello.
Good afternoon, everyone. I'm Audrey, and welcome to another Facebook Live session of Ask Your Asian Eye Doctor. So, as we age, we experience what can be described as drooping of the eyelids. That's more commonly or more scientifically referred to as ptosis. And this afternoon, what we'll do is we'll discuss what causes ptosis and what increases your risk of developing it, and how this can be treated. So we'll also be discussing eye bags. What are eye bags, and can eye bags still be removed? I think that's a problem a lot of us have, especially as we work and study at home. And sometimes maybe our days are much longer, or sometimes we end up working at night. So it's a problem a lot of us have. But before we start, let's welcome Dr. Franklin Kleiner. Hi, Doc. Good afternoon.
Hello. Hello. Good afternoon to everybody.
Okay, so Dr. Kleiner specializes in oculoplastics or eye plastic, lacrimal, and orbital surgery. He completed his medicine degree, internship, and residency at UP-PGH in Manila. And then he underwent fellowship trainings in ophthalmic plastic reconstructive and orbital surgery in two hospitals. The first was University of Cincinnati Medical Center in Ohio, USA, under Dr. Dwight Culwin and Dr. Robert Kirsten. And the second is from the Kantonsspital Winterthur Augenklinik in Switzerland under Dr. Martin Hatt. So when it comes to eye plastics, Dr. Kleiner has definitely done a lot of his research, a lot of his training under well-known experts in the field. And right now, he's the current head of Plastic Lacrimal and Orbit Service of the Asian Eye Institute and the Rizal Medical Center. He also established and launched the Oculoplastic Fellowship Training Program at the Rizal Medical Center and at PGH. And he has trained a total of about 7 oculoplastic specialists in the Philippines. He's also held several notable positions, including being the former president of the Philippine Society of Ophthalmic Plastic and Reconstructive Surgery, or PSOPRS, and he's the former chairman of the Department of Ophthalmology of Rizal Medical Center, as well as the former chief of oculoplastics at UP-PGH. So Dr. Kleiner is also a founding fellow of the Asia Pacific Society of Ophthalmic Plastic and Reconstructive Surgery. Okay, so that's a lot, Doc, when it comes to experience. You've really gone through a lot, and you've headed a lot of institutions. But first things first, I'm sure everyone wants to know about ano ba tong drooping of the eyelids at saka yung eye bags, Doc? And how is that related to oculoplastics? What is it, and what conditions does oculoplastics treat?
Well, oculoplastics or oculoplastic surgery is the short term for the longer name, which is ophthalmic plastic and reconstructive surgery. And that includes surgery of the orbit and surgery of the lacrimal system, no? Which we don't put in the name anymore. Otherwise, it would be even longer.
Haba,
Haba. So this is a subspecialty of ophthalmology, because ophthalmology deals with the study of the eye and all the ocular conditions, no? And eye diseases. So oculoplastics deals with the eyelids, the orbit, and the lacrimal system.
Okay.
So everything outside of the eye, no? The eyelids, the orbit is
So
the
this whole area, right?
like the bone around the eye, yun ang orbit, no? And then the lacrimal system, yun yung
drainage.
Tear drainage system, di ba? So where the tears drain. And if you get a block there, then you can get a lot of tearing. Okay? So these are all the different conditions, no? Sa eyelids naman, drooping is a big part of it.
Yes. At saka halata kasi siya, Doc, diba? That's the thing with something that has to do eye plastic surgery. The things that are things that people can notice immediately when they look at your eyes. So I'm sure it's something that kind of parang siyang takaw pansin. Kasi kapag kumakausap ka ng tao, the first thing you look at is typically are their eyes. So you can tell if parang may hindi pantay, right? Or bakit parang mukha siyang pagod? That's what I've noticed, like maybe for a lot of older people, the thing that happens when their eyes droop, it makes them look as if they're sleepy or they're tired or parang they're bored.
Yes. And a lot of patients with ptosis have that complaint that why does everybody think that I'm sleepy? Why does everybody think that um, lagi ka, ang comment sa akin, lagi ako nakatok, gano'n. So,
Okay.
yeah. So, drooping of the eyelids, okay. First of all, when the eyelids droop, okay, the more common complaints are it blocks the vision.
Yes.
So, parang nakakaharang sa paningin, no?
So parang yun ba, Dok, yung parang hinahawakan nila? So it looks like, it's as if masakit yung ulo niya, pero in fact, nag-droop lang kasi to. So sinusupport nila with the finger.
Yes. Actually, here you can see with here in the pictures that we have, you can see in the first photo, okay. Actually, the key to know whether you have ptosis or not is the reflection of the light.
Okay.
If you would shine a light into the eyes, you can always see the reflection. Okay, that reflection, that little white dot, that is where the light passes into the eye.
Okay.
So like here on the first picture, you can see the light reflection on the right eye, but on the left eye, you can see that the reflection of the eye is already very close to the border of the eyelid, and the eyelid is going to cover it already very soon. And if you don't see the reflection, then it's very likely that the eyelid is covering the opening of the eyelids or the opening of the pupil where the light passes into the eye. So, yung una, yan ang talagang typical appearance of ptosis, the first picture. No?
Okay.
The second picture, you can see that hindi pantay eh. Yung right eye is lower than the left eye.
Okay.
So parang, so there's a drooping of the eyelid on the right, no? And down below, you can see that the boy is using a finger to lift his eyelid so that he can see properly, no?
Okay.
So sometimes that's a mannerism of some of the patients.
Nasanay na lang sila, Doc, to do that, to support their vision.
Yes.
Okay. So I think yun, siguro when it comes to the symptoms or the common things na sinasabi ng mga pasyente, it's una siguro yung sinasabi ko, parang may humaharang sa paningin ko. So like in the first example, there's literally that skin that's in the way. Kaya kapag inilawan mo, yung point kung saan pumapasok yung ilaw, para siyang masyado nang malapit dun sa balat. Okay, so that's the first. And then yung parang kailangan mo nang itaas gamit ang daliri. Kasi yun nga, like yung sa last image at the bottom, is that parang kailangan mo ng external factor to keep it up so that you can see. And then the other is that yung mata mo, mukha siyang mapungay or yun yung sleepiness. So I think that's kind of like the image in the middle, but at the same time, you can just tell na hindi siya pantay, right? So the one eye looks like, oh, it's a little bit tired. The other eye, though, wait a minute. Parang there's something up here kasi hindi nagmamatch sa itsura nila. And then, Doc, what are the other parts of the eye naman ang affected kapag meron kang eyelid drooping?
With drooping of the eyelids, we actually have a muscle, okay, that pulls the eyelid up. And this is called the levator muscle. So the levator muscle stretches from behind the eye, okay, all the way back in the back of the orbit, and that muscle comes forward and attaches to the eyelid. And that is the muscle responsible for pulling the eyelid up. Aside from so that muscle, if you have a problem with it, then you could have drooping. Okay, either a problem with the muscle or a problem with the nerve.
Okay.
This muscle kasi is innervated by the third cranial nerve, no? And if you have a paralysis or a weakness in the nerve, then you could develop also paralysis or weakness in the muscle. And the eyelid, or rather the muscle, also attaches to the eyelid skin.
Ah,
You know how we always have a little line there
yung
that
fold. Yeah.
called the lid fold or the eyelid crease, no? And that is caused by that muscle because that muscle sends attachments to the skin, and when the muscle contracts and pulls the eyelid up, sumasama yung balat.
Okay.
So magkakaroon ng line doon.
Oo. Ay. So that's the purpose of it. That's why may ganon ang mga tao.
Yes, yes.
So in this case, Doc, parang yung pagkaka-describe mo, yung function ng pag-akyat at baba ng eyelid, hindi lang siya balat. Like yung gumagana dyan na parte ng mata mo, may muscle siya, may nerves, and may skin. So kung merong problema, ang kahit alin doon sa tatlong yon or a combination siguro of two or maybe all three of it, meron talagang mangyayaring parang drooping or some sort of imbalance that might happen when you're trying to open your eyes or close them. Ganun ba yun, Doc?
Right. Well, we'll get into a little bit more details a little bit later when we discuss the different kinds of drooping, because not all kinds of drooping are the same.
Oo. Kasi depende rin siya kung ano ba yung nagdo-droop talaga or whether nga yung muscle mo or yung balat yung may problema. Kasi yun, Doc, ang parang nakiki-impression ng mga tao na kapag merong nagdo-droop sa eyelid mo, iniisip na baka may extra lang ako na balat. Or dahil tumatanda na, yung balat doon nag-loose na talaga. So, madaling isipin na, kung bawasan na lang yung balat, solve na yung problema. But in fact, like you're saying, depende. Ano ba yung nagdo-droop? Baka may kinalaman sa orbit na yung kilay, the part, or baka dun sa balat mismo, baka merong nangyari dun sa nerves, or baka may nangyari dun sa muscle. So ito yung sinasabi niyo, Doc, na parts of the eye dito sa nakasulat na aging eyelid.
Yeah. So actually kasi the eyelids are affected and are usually affected by aging, no? So as we get older, there are changes around our eyelids, okay? So the skin becomes very lax, okay? The muscle sometimes can detach, okay? And if you have a very lax skin, that can droop down and cover your eyelid. Or if there's a detachment of the muscle, then that can also cause the eyelid to droop down. No?
Okay.
But aside from that, you also have more lid creases. The brow can come down and contribute to a lot of skin in the upper lid. And your eyelid can look puffy because maybe you have some fat or some eye bags around. You know, our eyes kasi have fat around it, which as you go older, tend to prolapse and come forward, no? And cause the eye bags, no? Because the tissue of our skin becomes very lax, and so the fat also comes forward. So those are the eye bags that we usually see in the lower lid when we get older.
So, Doc, sinasabi mo na parang when it comes to yung aging, so it's eye bags area, na when you say nagpo-prolapse yun, parang does that have to do with yung nag-weaken lang talaga yung part ng eyelid na yon, yung lower eyelids? Kaya, you have these eye bags that have more fat in them.
Well, usually kasi when we're a little bit younger, our skin and the other tissues, like what we call the orbital septum, they're still very tight. Everything's very tight. And so everything's still in the normal place. As we get older and things start to loosen up, then the fat gets a little bit displaced and can come forward. And this is what is known as the eye bags. Okay. So excess fat and excess skin.
Okay. Sige, in that case, Doc, parang you were saying kasi na depende rin yun kung nag-loosen yung skin or yung muscles, no? So, if I'm the kind of person na medyo mahilig ako mag-rub ng mata, is that something na can lead na yung eyes ko mas likely na mag-droop as I get older?
Yeah, actually, rubbing of the eyes can actually be a risk factor also for loosening and laxity of the eyelids. So, People who have, let's say, chronic itchiness of the eyes, they tend to rub it a lot.
Yes.
They're probably prone to develop eye bags a little earlier.
Okay. So that's ano pala, a good way to remind people to stop touching their eyes, di ba? Kasi kamot ka ng
Oo,
kamot.
baka magka-eye bags kayo.
Oo. That's a good tip, Doc. I think that's something important for the people that are watching us today. And then, Doc, I think we have another set of images that shows naman kung ano yung itsura ng levator detachment. Yung sinasabi niyo, Doc, parang yung muscle, kapag detach siya, doon lumalabas yung hindi siya nagpapantay. Yan.
Okay, so probably we can start getting into the different types of drooping or the different types of ptosis. Usually kasi, if your muscle is actually strong, okay, kasi we can test the muscle and see how strong it is. So if your muscle is strong, what happens is you would develop you can develop drooping when that muscle detaches from the eyelid, no? So like in this patient, his right upper lid is drooping down lower than the left side. No? If you test his muscles, they're actually very strong. Okay, so all we really need to do to correct that is to during the surgery, we look for the muscle that pulls the eyelid up and then reattach it back in its previous position, connect it back to the eyelid in its previous position.
Okay.
So it's like a little bit of a tightening of the muscle.
Okay.
And so here, you can see the patient after surgery, medyo pantay na yung dalawang eyelids niya.
Oo nga, Doc. It makes such a difference.
Yeah, and you can see the reflection of the light in both eyes are very clearly in the middle, and the eyelids are far away from the reflection of the light.
Oo. Oo nga. Actually, Doc, parang na-describe mo yung kung paano ginawa yung surgery niya. Napapaisip ako, parang para siyang yung sa blinds, right? So meron kang parang, usually yung structure ng blinds, there's like a string that attaches it for the whole length eh. Yung buong length ng yung blinds mo, kapag hinila mo siya, using the string, di ba, umaakit siya ng buo, or halfway lang, or it comes all the way down. So, the way yung ginawa niyang surgery, it's like in-attach, sinigurado niya lang na buo pa rin yung pag-attach ng blinds over his eyes. So now, if he uses his muscle, meaning, gusto ko na dumilat ng malaki, then the muscles move fully up para kitang-kita yung mata niya. So ngayon, parang mas may control na siya. Tama ba, Doc? I mean, when it comes to yung analogy of it does kind of come across na para siyang window blinds.
Yeah, well, not exactly, but similar. I guess that's a good analogy also. No? But what we do really is to usually when we open when we look at the muscle during surgery, we have to look for the muscle, and we usually find that it has detached. So we have to reattach it to the eyelid, usually in 3 places.
Okay.
Yeah, because like the blinds may attachment na yan eh.
Oo.
But for us, we have to attach like one in the middle and then one on each side. No?
So siguro kasi
otherwise yung blind mo magiging tabi.
Which happens, Doc, which happens with actual blinds. Kasi isahan lang yung pag-pull mo, minsan tilted siya. So, diba? So that makes sense kasi kung i-reattach mo siya in more than one place, right? Left, right, center. Yes. Mas sigurado, mas solid yung pag-pull ng muscle. It makes sense,
right.
Naman. And then I think we have another image naman. Here, levator detachment, ptosis repair with blepharoplasty.
Okay, so in some cases kasi we have the eyelids that are drooping, but then we also have excess skin at the same time. So aside from reattaching the levator into the proper position, we can also remove a little bit of the excess skin. Okay, and that would so like in this patient, you can see the amount of skin that we removed, no? There in the middle picture, no? And in addition to removing the skin, we also reattached the muscles to the eyelid. So the patient has improved vision, no?
Mm-hmm.
Again, you can see the corneal reflexes, no? The reflex of the light in her eyes.
Mm-mm.
Whereas previously, wala.
Yes, correcto. Kasi kung i-compare ko yung pinakaunang photo niya to the last one, it's like magkaibang tao na siya. You know, it's a different person altogether. Siguro ito yung tipong tao na kapag matagal mo na siya kaibigan and then you see her after couple of months after she's done the surgery. Oh, anong ginawa mo? Parang you look so fresh, you look so awake, right? You look more alive.
Yes, yeah. There's a big difference. The appearance after the surgery.
Oh, and I think yung interesting kasi dito, like if you look at the last photo, it looks very natural. I think yung isang malaking fear when you're getting anything done sa my eye area is that baka mukhang pinagawa, right? Versus mukhang naturally akong nag-age gracefully.
Yeah. But remember that here, we're not doing this for cosmetic reasons. We're really doing it for
Function.
correction of her vision, for function, no? So that she can function properly. And if in the process you also get a good cosmetic result, then that's a very desirable bonus. That's a bonus.
So I think it's good. Like, I think that's something good to look forward to for anyone that is coming to you na sasabihin na, Doc, nahihirapan na akong makakita. They think it's a different problem. They might have headaches kasi nahihirapan na sila to look through yung droopy eyelids eh. And then afterwards, makita na lang na improve yung function niya. Mas malinaw na yung nakikita. And then at the same time, mas magandang tingnan, right? So I think that's a nice balance of things. And it might help people na kapag nag-decide siya, gagawin ko ba to o hindi? Ano ba yung i-look forward to? Kasi I'm sure that when it comes to any surgery, it takes time bago ka mag-recover. So if you keep in mind, sige, ito yung kailangan kong gawin, kailangan ko sumunod sa doctor's orders, but ang result natin is better function, better vision. And then how about this next image naman, Doc? For levator detachment, also for ptosis repair with blepharoplasty. So when it comes to these things pala, Doc, it's really different on a per-person basis, no? It could be the same kind of condition and the treatment might be the same, but the way it appears pagkatapos, magkaiba rin siya.
Yes, well, in this patient, he's actually an elderly patient, but he also has similar problems. No, the eyelids are really coming down and drooping, but when you test it, the muscles is still very strong. So this is another example of when we went in, we remove a little bit of skin, and we also tighten the muscles of the eyelid at the same time. So usually these patients, when they undergo surgery, it has to be under local anesthesia, and they have to be awake because we usually sit them up and adjust the height of the eyelids during the surgery.
Oh, wow. Okay. So wala silang nararamdaman, Doc, but you just have to ask them to, sige, can you lift your eyes back?
We have the local anesthesia that is given before the surgery, no? And with the local anesthesia in place, usually hindi naman masakit, no?
Parang siguro aware lang sila of what you're trying to do, and they have to be able to listen to you, no, with your instructions para makita nila magiging mapapantay nyo yung the muscles or the skin as it folds down.
Yeah, some patients want to have it done under a little bit of sedation, but if you have a problem with the drooping or the ptosis, we don't advise sedation because once you're sleepy, we will never know the real height of the eyelid.
Oo, oo. Kasi para i-approximate mo kasi you're not sure kung talaga bang ganun yung normal height niya or that's just how it looks when you are in fact sleepy or tired.
Yes. Okay.
Okay.
Yeah,
And
that's
then,
right.
Doc, sorry, you were mentioning kasi na when you do the surgery, you also test how strong the muscle is. So kapag sinasabi mong tinetest siya, is it something na ginagawa mo prior or yun yung ginagawa during the surgery na?
No, prior to the surgery, we have to. These are one of the preliminary tests that we do to determine what type of surgery is going to be done. Because if you have a very weak muscle, we do a different type of surgery.
I see.
So,
Okay.
we'll see in the pictures a little bit later.
Okay.
So maybe we can go on to the next picture.
Yes. So the next one is drooping of eyelid skin,
Yes.
and
Okay.
brow plastic.
So you see this is a little bit different from the previous patients that I showed. No. So the previous patients, their muscle was very strong but detached. Okay. Now this particular patient, okay, had drooping of the skin, and I had a picture of baka tinanggal na. I had a small picture there showing somebody lifting the eyelids up like this. Okay, and if you like, this patient has a lot of excess skin only, no? Because if you lift the skin up like this, then you can see underneath, and you can see that his eyelids underneath are not really drooping. Okay, I don't know where that picture went. Nawala eh. But in his case, he had also drooping of the brows. The brows were coming down, and when your brows come down, it pushes more skin in the area of the eyelid. Okay. But if you lift the eyelid up like this, or if you lift the eyelid skin up, you would see that underneath his eyelid is not really drooping. So in this case, the problem is really just skin overhanging. And with this, rather than adjusting the muscle, all we really need to do is to remove a little bit of skin, and fix the eyebrows a little bit higher, and this is the end result. The skin is no longer drooping down anymore and covering his vision. Okay. So in this case, we just did what we call a blepharoplasty, okay, which is like removal of the eye bags.
Okay. Pero interesting nga siya, Doc, and it also does show a significant improvement in both eyes dun sa after photo. So, mas nagpantay siya, and then parang mas malinaw na nga yung, you can see their eyes more clearly. And then I think in the next picture, it's a case naman of what happens kapag merong severe ptosis ang isang pasyente, and what happens if you treat them using blepharoplasty.
Right. So in some cases, like I was mentioning a while ago, you have both the drooping and you also have the excess skin. And so if you remove the excess skin and you adjust the muscle, then you can restore them back again to their to the previous level of their eyelids. No? So their eyelids are nice and open after the surgery.
Okay. And then yun nga, Doc, yung sinasabi niyo, medyo significant nga yung amount of skin na tinanggal para ma-lift eh. Yung itsura niya mas maging lifted. And
yes,
oh,
we have to be very careful when we measure how much skin to remove. We have to be very careful because we cannot remove too much skin. Removal of too much skin is very bad for the patient because they will not be able to close their eyes properly.
Okay. Okay. So
We're very careful
kailangan
with that.
maingat talaga pala, Doc.
There's a lot of measurement that is involved in prior to making our markings when we make the marks for the
Okay.
surgery.
And then, Doc, you were saying that sometimes yung nagiging dahilan ng ptosis is merong problema dun sa nerve or parang may weakness dun sa nerve or dun sa muscle. Uh, can that happen? Kunyari, can that happen to congenital? Can someone be born with that kind of condition?
Yes. So there are some cases where there's really a problem with the nerve or there's really a problem with the muscle. So it might be inborn. Okay. They may be born with ptosis. We call that congenital ptosis, no? Where the muscles are really very, very weak and they cannot bring their eyelids up, no? Or they could have a problem with the nerve, no? So if there's a paralysis or a paresis of the nerve, like for example, nagkaroon ng stroke, di ba? So pag nagkaroon ng stroke, then you can also have a paralysis of the muscles.
Mm-hmm.
Or sometimes if you have trauma to the muscle, let's say you had an accident and the muscle was very severely damaged, then sometimes you can also have a very poorly functioning muscle. So like in this patient, this is an inborn condition. If you would look, her eyelids are really covering her her pupils. In other words,
Yung pasukan ng
parang
ilaw
talaga sa sa yung pasukan ng ilaw dun sa mata, no? So her eyes are really being her vision is really affected and being covered.
Oh,
Tapos tingnan mo yung eyebrows niya. Yung
yes,
eyebrows,
yes.
she's pulling her eyebrows up very
Yes.
much.
Oo.
Okay?
Nasa-sense ko yung yung effort to lift
Yes.
the eyebrows.
Right. She's exerting effort on her eyebrows. Sometimes it's already unconscious, no? In other words, subconsciously they're doing it without actually doing it voluntarily. Involuntary yung pagtaas nila ng eyebrows nila, no?
Mm-mm.
In an effort to open their eyes. Okay?
Okay.
And in these cases, because the muscle is very weak, even though we shorten the muscle, it's not going to function properly.
Mm-hmm.
So in this case, what we do is we do a repair with a silicone sling or with any type of sling. Sometimes we get tissue from the leg, which is called fascia lata,
Mm-hmm.
and we use that as a sling in order to lift.
Okay. So that's why parang yung 3 dots above the eyebrow, parang that's the kind of mark.
Yes, that's where we insert the sling, no? So we tie the sling to the parang sinulid yan eh. You tie the sling to the eyelids, and then you see where the dotted lines are. Dun yung pataas, and we suture it up to the eyebrow. Para when the patient lifts her eyebrow, tataas na yung eyelid niya.
Ang galing do. Okay. That's interesting kasi oo nga, like even the way that you describe it's easy na ma-imagine like how you did it. Na, oo nga naman kasi you're taking tissue from another part of the body tapos and you're using the same thing to essentially make it easier for the patient to be able to lift their eyes. Oo nga naman, interesting. And then yung for me, yung maganda doc is that dito sa after photo mo is that hindi discernible na parang may in-insert ka doon above the eyebrows. Like you can tell where you had placed the dots. Pero otherwise, you would not have thought na merong change. There was something that you really had done in that area.
Yes. The way we do it is that we try to make it always look cosmetically acceptable afterwards. No? So aside from creating a line for the patient, we also suspend the eyelids up. And when she lifts her eyebrows, she will be able to lift the eyelids as well. Now, the drawback with this type of a procedure is that when she closes her eyes, she will not be able to close them completely. But if she forcibly closes them, she will be able to. But sometimes when they're asleep, the eyes open just a little bit. There's a little bit of a crack, and you can see the white of the eyes there. But that's certainly better than having the drooping eyes all the time.
And I think there are some people that naturally when they sleep, no, doc, kahit alam mong nakapikit na sila, pero gano'n nakikita mo rin yung puti ng mata. Like, hindi nagko-close ng completely yung eyes nila to begin with. So, siguro, kung hindi mo siya kilala, I happened to see her asleep and there was a little bit of the white na makikita mo, hindi mo siya iisipin as something completely unusual. You're correct, parang cosmetically acceptable. Parang, okay, ganun lang siya matulog. Pero at least, if you look at her, yung after photo niya, parang nawala yung strain dun sa kilay, yung hindi na siya nagpo-pull up, yung
Right.
mas neutral na yung position niya, mas neutral na yung expression niya.
Yes, that's true.
Mm-mm. And then how about, Doc, you were talking about there are also conditions na kunyari yung Myasthenia Gravis, na parang how does this work naman, Doc, and what does it do to your eye that causes the drooping?
Right. So this condition called Myasthenia Gravis, this is a different cause for ptosis. And in this condition, it's really a chronic disease, no? Because ang problema dito sa Myasthenia Gravis is what we call there's a chemical that we call a neurotransmitter that signals from the nerve to the muscle, no?
Mm-hmm.
So, but the signal comes from the brain, it passes through the nerve, and then it goes to the muscle, no?
Mm-hmm.
So this is the signal for the nerve to tell the muscle to move, okay? So between the nerve and the muscle, there is a chemical there called the neurotransmitter, okay, which passes the signal to the muscle. And there is a problem with that chemical. It mabilis siya maubos.
Okay.
So with constant stimulation of the nerve, okay, nauubos yung muscle, nauubos yung chemical, and so there's a fatigue. No? In the beginning, they're able to do it, okay, but after a while, they cannot lift their eyelids up anymore. No? Papagod na yan at babagsak na yan. No? But if they rest again for even 1 or 2 minutes, bukas na naman yung mata nila ng normal.
Okay.
So these types of conditions, they're very difficult to operate on because the level of the drooping is variable. Minsan mataas, minsan mababa. So paano mo siya operahan? Luckily, there is a medicine for this. So all they really need to do is to run some tests to make sure that they have the myasthenia, and then they can get a medicine called Mestinon, which would keep their eyes open for them already.
Okay. Kasi yung parang the way that you described it, yun yung literal na when people say, halos hindi ko na mabukas yung mata ko. So parang ganun yon. Hindi sa ayaw nilang mabuksan, yun lang naubos lang yung chemical that allows them to be able to open up their eyes and close them as normal. So it's good to know na if you have that condition pala, is at one, pwede mo siyang ipatest kung yun ba talaga yung condition mo. And then may gamot na for it. So kapag meron ka bang gantong condition, Doc, para siyang, you're saying chronic siya, so it's just something that you need, like, you treat it like it's maintenance medicine. You just have...
Magiging maintenance medicine mo yan. Oo. Now, some of these cases, after treatment for a long time, then sometimes they would also need some surgery later on. But the key really to solve the problem initially is the medication. No? So, first of all, you have to be able to discover that you have the problem, and secondly, that you be able to treat it properly. No?
Okay.
In these cases, kasi surgery is not the solution. No? It is really the medication. So there's some cases like this na ptosis or drooping na pwede naman gamutin ng gamot.
Okay. So it's good to know kasi parang iniisip ng mga tao, ay, drooping, ayoko pa-opera. Ganon. So baka hindi nila ipa-check. But in fact, kung nataon na you actually have this condition, mas mabuti ipa-check mo para alam mo agad na yung parang, kumbaga unfounded, hindi mo kailangan mag-alala pala ng sobra-sobra. May gamot naman for it, and only kapag hindi na siya pwedeng masolve ng gamot, then doon natin pag-usapan yung surgery. So at least you know na meron siyang step-by-step procedure and malinaw sa'yo kung at what point mo na kailangan each of those interventions.
Right.
And then, Doc, kasi with all the examples that you showed, right, all the before and after photos, siguro, I've noticed that some of the treatments are the same for like the similar cases, pero may times na iba siya. So the treatment, depending on the type of drooping, nagbabago talaga, Doc. So does that mean it's just a matter of ano ba yung makikita ninyo kapag nagpa-consult na yung pasyente?
Well, that is the importance of seeing a specialist, no? So that we will be able to identify what the problem is, what type of problem you have, and what is the appropriate management for this condition, no? Kasi hindi naman lahat ng drooping ay pare-pareho. So may iba-ibang klaseng drooping, may iba-ibang lunas din sa mga drooping na yan.
Okay.
Iba-ibang klaseng drooping.
Okay. So, Doc, when it comes to yung pagpapa-opera, so let's say may isang pasyente, pumunta na siya sa'yo, nagpa-check up, tapos na-determine niyo na kung ano yung dahilan ng drooping ng eyelids niya. Yung surgery ba, inpatient ba to? At you were saying kanina, usually, hindi ka sedated. You only have local anesthesia. So, how are eyelid procedures usually done?
Yeah, these are all done outpatient. So the patient comes in the morning, then we do the surgery, and they can go home afterwards.
Matagal ba yun, Doc? Like, it's an eyelid surgery. Does it take several hours or fairly quick?
Usually about 1 to 2 hours on the average.
Okay.
Yeah. We put a little anesthetic. Yan ang masakit na parte ng konti kasi injection yan. Pero once nakalagay na yung gamot, hindi na masakit yan. And even though you're awake, gising ka, you should not really feel the pain and you can tolerate the procedure quite well.
Okay.
Tapos, after the surgery, we ask you to use some ice for 2 or 3 days. You'll be putting ice there, and we don't cover the ice. No, we just put a little bandage on top. Okay, then we send you home with some ointment. Lalagay mo yung ointment dun sa mata, dun sa mga sugat. And then meron ka rin konting antibiotic minsan na iniinom or para sa sakit. No, and in about a week you can come back and we remove the sutures. And obviously, magkakaroon ng swelling, magkakaroon ng bruising, minsan mamamagayan, magkakaroon ng konting pasa yan. On the average, usually about 2 to 3 weeks ang healing time.
Okay.
And usually, most patients are okay by 2, sometimes 3 weeks.
Okay. So, you mentioned, Doc, kasi that we use sutures kasi syempre you're trying to remove some of the skin or you're trying to move the muscle. So, when it comes to the sutures, is it always the kind of suture na kailangan mo tinatanggal afterwards? And I noticed kasi with some of the photos that you posted, hindi naman ganun ka-discernible. Diba? Iniisip natin kapag merong tahi, yung kita mo siya, obvious na obvious. But in your case, actually, hindi siya ganun kahalata. So, when you actually mentioned na, yes, there are sutures to be removed, pero okay, buti na lang hindi siya sobrang halata. So, if yung pagkakagawa, pinutin siya, even when you remove it, merong swelling, merong bruising, pero hindi siya sobrang discernible, hindi siya obvious, kumbaga.
Yeah, we actually use very fine sutures. So, manipis lang yung suture natin. And we do it under magnification. No? So, may sinusuot tayong mga loops para magnified yung ano natin. So kahit maliit yun, makikita pa rin natin. No? And then, the other one is the placement of the incision. So ibig sabihin, kung saan natin ginagawa yung incision. So nakatago naman yan. Kung saan natin lalagay yung lid crease o yung lid fold, doon natin tinatago yung incisions. No?
Okay.
And the lower lid,
Ah,
For the lower lid, we place the incisions just underneath the eyelashes para hindi halata.
oo.
Medyo nakatago rin
Oo
kahit
nga.
dun sa labas.
Mm.
And if we remove the eye bags, we can even put the incision inside sa loob, sa likod na parte ng talukap dun sa loob para
Hindi talaga kita.
there's really no incision on the outside. It's all from the inside.
Okay. Ang galing daw. Kasi at least yun nga, hindi siya halata. So when you're healing, there's walang bulge of some sort from where an incision was placed. Doc, I understand, like, I'm sure in other kinds of procedures, pag minsan they say that they use the kind of sutures that kind of melt into your skin. Is that something that's done for mga eye surgeries, or hindi naman siya as commonly used?
Yes, actually, we can use those types of sutures, and we do use those types of sutures, but usually we put those on the inside. Permanente yan sa loob, no? You could use it on the outside, but sometimes they create a mark where you pass the suture. And so I personally don't like to use them. I'd much rather put the sutures in, use a material that's not that doesn't create a mark very much, no?
Mm-hmm.
And then remove them after a week.
Okay. So at least may options. At least now we know that it depends rin sa style ng doctor. So in your case, you prefer to have the suture that you can remove afterwards pero no discernible mark, versus a kind that, minsan kung saan mo dinaan, doon mo siya napapansin na, okay, may something na ginawa dyan. So interesting, Doc, na meron palang ganong kinds of decisions that are made, and it depends. So mahalaga na kapag kinausap mo yung doctor mo about your case, and if it's something na alam mo will bother you about yung outcome ng surgery, mahalaga na sabihin mo sa doctor na, Doc, yung worry ko, gusto mo pa-surgery, pero ayokong may ganitong bulging after it's done. So at least naka-manage yung expectations nyo.
Yes, all these things can be discussed with the patient before the surgery.
Mm-hmm. Mm-hmm. And then, Doc, you said kasi na after the surgery is done, yung downtime mo is usually between 2 to 3 weeks. Depende na siguro kung gaano kabilis ka rin nag-heal. Kasi iba yun from a person-to-person basis, it really does change. And depende rin kung paano mo inaalagaan siguro yung incision point, yung mga ganong bagay. Is there a lot of discomfort or pain kapag nag-recover ka from yung ganitong surgery?
Actually, not very much. Most people don't really complain too much about the pain or the discomfort. No, I think going to a dentist and having your tooth pulled is probably worse.
Ang lalim ng Doc, no? Parang when you remove a tooth kasi, there are nerves down there also that, make it more sensitive.
Masakit din kasi yung ngipin, di ba? But, for eyelid surgery, we usually don't have that much of a problem. Especially if they will follow what we ask them to do, like to put ice for the swelling. And if they take pain relievers, usually after a day or two, it's usually okay na.
Mm-hmm. And then, Doc, when it comes to yung recovery, so let's say, I'm sure after the day after surgery, typically bumabalik si patient, no, para ma-monitor may healing niya. And then, yung susunod niya ng check-up is after a week and then after a month. Usually, ganun din pa siya.
Yeah, we usually see them weekly. Even though we remove the suture after a week, then we usually see them by the second and the third week. In case so that we can monitor their healing a little bit better.
Mm-hmm. And when it comes to yung recovery period, ano yung mga hindi nila pwedeng gawin while they're recovering?
Well, we advise them not to exert too much effort, no, like exercising and stooping, bending, lifting. It's better within the first week or two to take it easy. Ang kalaban kasi natin dito, yung pamamaga, minsan yung pagdudugo after the operation, minsan bigla na lang dudugo yan. Kunyari, magja-jogging ka o ano,
Oo.
biglang dumugo na lang yan.
So,
So those are the things we want to avoid, no? So once everything heals, then they can gradually go back again to their previous activity.
okay. So kung ganun, Doc, siguro lalo na for yung older patients na baka nag-aalaga ng apo. So let's say if they're still recovering from, this type of surgery, wala muna tayong buhat-buhat, wala muna running around with the kids. Kasi yun yung siguro, baka hindi nila mamalayan that they're doing something na strenuous na.
Yeah. So yung mga apostolic duties na yan, pwedeng i-postpone na lang.
Oo, on the upside siguro, Doc, yung naisip
And also some of the housework, I tell the housewives,
wag muna.
Wag muna, pautos mo na lang sa iba muna.
Oo.
Bakasyon ka muna sa housework.
And it might be better, maybe after the 3 weeks, ma-realize niya, kaya naman palang gawin ng ibang tao yan. Down the line, they realize, maybe, I should take it easier, no? You don't necessarily have to go back to that kind of housework. And then Doc, siguro, with the eyelid surgery kasi, syempre, you usually do it one at a time. So, or does it happen na yung sa drooping, on the same surgery, you do both eyes already?
Yes, we always, as much as possible, do both eyes at the same time. Especially if we have to make things even out, no?
Mm-hmm.
Kasi sometimes it looks like one is lower than the other. So sasabihin mo, edi yung mas mababa na lang operahin mo. But sometimes, actually they're both drooping and one is drooping lower than the other. So both of them actually need to be fixed.
Okay.
Most of the time it's that way.
Mm-mm. And
of course, if you're going to remove the eye bags, hindi ka naman pwede magtanggal ng eye bag sa isang side lang. Kailangan isabay mo na yan, sabay na, dalawang mata, sabay na yan.
So,
diba?
so let's say, nataon with this particular patient, nagdo-droop yung eyelids niya, and at the same time, napapansin na parang even here, the eye bags are quite prominent. So, it can happen, Doc, na all four gawin mo na.
Yes. But actually, kasi if we're going to remove just the eye bags, then I would recommend doing all four at the same time, no? Yung sa taas, dalawa sa taas, at saka pati na rin dito yung dalawa sa baba. And we can sedate you for that procedure. Ibig sabihin, pwede ka nang patulugin para dyan, no? It's still outpatient, pero bibigyan ka ng mas konting pampaantok para relax ka during the procedure.
Okay.
The ptosis is a little bit different because we have to keep you awake during the procedure. That one, kung mag-a-adjust tayo kasi ng muscle, mas delikadong operasyon yan. And I prefer to just do the two eyelids if we're going to adjust the muscle. Okay. Kasi pag ginawa pa natin yung baba, baka pagtapos na tayo sa baba, magamagana yung taas. No? So,
mahirap na.
Yung mga pinaghirapan natin dun sa taas, baka naman ma-compromise. So, usually we do the ptosis surgery, we just do the uppers, and we do the lower at a later time na lang.
Okay. And I think part of the benefit of doing it that way is that makikita nila, they're able to see the improvement of the ptosis first, and then it gives them a little bit more confidence na, sige, kung kailangan ko naman to go back in for eye bag removal, medyo sanay na sila with the procedure, there's a little bit more peace of mind. Mas relax na siguro sila the next time they have to come back for the surgery.
Yes, and then masisedate pa sila for the lowers.
Okay. And then, Doc, kasi when it comes to, let's say, nagpa-ptosis surgery, does that affect, let's say, the wrinkling around the eyes?
Okay, so the wrinkling around the eyes is not really, hindi yan nawawala with the ptosis surgery or with the eye bag surgery. Mm-hmm. The eye bag surgery is to remove the excess skin and to remove the excess fat in the lower lid. The wrinkling of the skin, especially out here, mas maganda para dyan yung Botox.
Okay.
Because with Botox, you can relax the muscles out here on the side, then hindi yan magre-wrinkle masyado.
Okay. So yung good thing siguro, Doc, let's say if it's a patient that gets ptosis done, so nakita niya na improvement in the vision and then the function of the eyes, and then if it so happens na nag-bothered pa siya by these wrinkles around the eyes, then they can also talk to you na parang, okay, I think I'd like to try some Botox, and you can also do that for them.
Yes, of course, we can do all of that, pero
May spacing.
programmed at the proper time and the proper interval.
Okay.
Siyempre, we usually fix the function of the eyes first, no? Many patients kasi when they come in, they're elderly, they have cataracts, diba? So sometimes they do the cataracts first because siyempre paningin yan, di siyempre yan talagang inuuna. And then they find out after they have the cataracts done, bakit hindi pa ako makakita ng malinaw? Eh yung pala, bumabagsak pala yung eyelids nila eh. Okay? And when they do this, aba, malinaw pala. You find out that the cataract operation was actually successful, but now they have a different problem. It's the eyelids that are drooping. So their eyelids fixed naman and it's okay na. And at the same time, pwede na rin bawasan na rin natin yung mga eye bags sa paligid. And syempre, they can see everything clearly now and they look in the mirror. And if they still want to have the little... Kasi nung araw, hindi nila nakikita yung mga maliliit na yan eh, di ba? So ngayon, nakikita nila, paayos na rin natin yan. Paayos na rin natin, Botox na lang tayo.
So tama, ganun nga, Doc. So meron palang parang process of elimination. So talagang first things first, ano ba yung kailangan maunang matreat? So in most cases, cataract surgery siya. And then we gradually narrow to, sige, kung meron pa something else that bothers you, then let's do that next. It could be the Ptosis surgery. And then if, let's say, there's wrinkling that bothers you, let's do Botox. And then if you have eye bags and you feel like you need to remove that excess fat, then dun tayo magpa-eye bag removal. Kasi yun na yung may sedation. So meron siyang process pala talaga, Doc. And at least every time, because you're doing it in stages, you can always see yung recovery ni patient. Lagi niya nababantayan how well they're doing afterwards. And again, they gradually get better at being able to take care of their eyes. Kasi syempre, napagawa mo na siya eh. You want to take care of it. You want to make sure na you're able to maintain that look, no? And that comfort level na malinaw na yung nakikita mo. And it also looks aesthetically pleasing. Okay.
Right.
And then, Doc, kasi when we talk about all these eyelid conditions, usually iniisip natin is for older patients. Pero there are cases, like first, that girl na talagang congenitally meron siyang problema dun sa paglift ng eyes. And then I think we do have a photo of another younger patient na ganun may konting difference lang dun sa eyelids niya. And then in this case, it's a younger patient and it does also show na it makes a difference kapag pala inayos yung ganong problema.
Right. So in this particular patient, she was bothered by the asymmetry of the eyelids, no? And sabi niya parang may drooping, pero actually if you look at her eyes, the opening, the openings are not very far apart from each other, no? They're more or less even. But what is more noticeable here is that the eyelid crease, yung linya, hindi pantay yung linya. So we can make that even also by just doing what we call a Blepharoplasty. It's also like eyebag surgery. And recreating for the patient the upper lid crease. Okay?
So in this case, Doc, parang it can be said na subtle lang yung change that you made, but it does make parang a world of difference. Kasi kapag tingnan mo na yung mata niya, oo nga, no? Parang nakikita mo yung improvement. Simple, pero it is significant enough na siguro to the person, no? Kapag nakikita nila yung sarili nila in their reflection, they can tell and they can feel the difference of having that repair done.
Right, which is why you have to undergo the proper examination also, because if the consultation and the examination is very important, so that we can identify exactly what is the problem that needs to be fixed. Kasi sabi ng pasyente, nagda-droop yan eh. Kailangan itaas. No? But actually, it's not really that is the problem. It's just that the eyelid crease is not even. So, yun na lang ang inayos natin. Pumantay na.
Mm-mm. And then, I think in the next photo naman, because we're talking about yung blepharoplasty, na here, upper lid blepharoplasty doc. So, how about with this patient? Anong change that was done?
Yeah, so sometimes just a little subtle change, removing just a little bit of skin in the upper lid, will already make a big difference, no? So the opening of her eyes improved, and you could see just a little subtle lid crease in both eyes. Many times, the patients would, if their friends see them, sasabihin ng friend na, oh, parang bumata kayo. Saan ka ba nagbakasyon? Anong ginamit mo? May ginamit ka bang eye cream or something? Hindi nila alam na nagpa-opera pala.
Oo.
But even just a very slight or subtle change can make a big difference. No?
And then with this, doc, siguro, one interesting thing with us being in quarantine, right, during the pandemic, if a patient were to come to you and have the surgery done now, wala ka naman pupuntahan eh. So actually, when it comes to your recovery, you will naturally stay home kasi may bruising yan, you're not supposed to do any vigorous activity. So it's actually the perfect time para mapagawa yung gantong subtle changes. Because yung difference nga, siguro with this particular patient, nararamdaman niya eh, na parang, alam mo, it's bothering me. And then if you get it done now, even if you were to see a family member or friends afterwards, even on a Zoom call, they would be able to tell na, uy, parang parang nakatulog ka ng mabuti during this quarantine, when in fact, nakapagpa-surgery pala sila.
Yeah. And yeah, that's right. So yeah, and the other thing actually is, nowadays everybody's wearing a mask.
Yeah.
And so the only thing that's really exposed are your eyes.
Mm-hmm.
So the appearance of the eyes are also very important,
Oo, that's right, Doc. Pag minsan doon mo na lang nakikilala ang tao.
Kayo, mata lang naman ang nakikita kasi naka-mask naman yun.
So parang with the exception of magsuot ka ng nameplate, even if you were to have any sort of procedure done in the eye, it so happened you had to go out, sinabi mo kasi, Doc, ang bandage lang naman na ginagawa. They don't even cover the entire eye anymore. It's just in the portion where the incision was. So hindi siya ganun ka-eyesore if you have to be seen in public. Let's say if you're just traveling, mula ka sa clinic, papasok ka ng kotse mo, short na yon, or let's say you may have taken a short walk outside. One, nakamask ka naman, di ka makikilala. And then two, your vision isn't blocked. Wala kang hindi covered yung eye mo. You can still you can watch TV, you can, walk around a little bit. Wala tayong OA, wala tayong aerobics, wala tayong cardio, walang lifting. But at least, your recovery can be done. You're in the safety of your home. So it's kind of hitting two birds with one stone, no? Mas malinaw na rin yung vision mo, tas aesthetically pleasing. So at the end of quarantine, let's say, you already see your family, maybe the last quarter of the year, you look well rested. Parang mabuti pala yung tulog mo para nakabakasyon ka ng konti.
Yeah.
And then, Doc, I think we have another photo naman. Well, of a patient that has yung eye bags, like very significant amount of eye bags. And it's something that maybe made them feel self-conscious kasi after a while, you feel like, oh, parang na to mukha na talagang laging pagod. Mukhang laging puyat.
Right. So these are the cases where the fat is really nag-prolapse and came forward.
Mm-hmm.
But the fat can be removed and we can tighten the eyelids also. So this was his appearance after the surgery. If you notice in the upper lid, we also removed some skin, but not too much.
Mm-hmm.
So lower lid is a big difference because we're really able to tighten it very nicely.
Mm-hmm. So, Doc, when you're saying that when you remove fat, is this similar to kind of like how we've seen yung ibang mga cosmetic procedure na kapag tinanggal mo yung parang hinihigop yung fat and then nakikita mo parang sinusmoothen talaga yung skin? Is it ganun din ba yun, Doc?
Well, are you talking about liposuction?
Parang ganon. Is it, kasi you're saying it's like fat that has kind of escaped. Medyo ganon ba yung nangyayari kapag eye bags?
Yeah, well, yeah, the fat that we remove there, it's really fat because the fat came from around the eye. The fat is really there to serve a purpose, which is to cushion the eye.
Mm-hmm.
But naging displaced siya, medyo
Bumaba na ako. So, yeah.
So when we remove the fat, it's really removed. I mean, it's really fat that we remove. But this one, we usually do it under direct observation, no? Kasi yung liposuction, hindi yan ginagawa sa mata. Kasi there are many delicate structures around the eye, and if you just, poke an instrument in there and try to suck the fat out, and sometimes it's not a very good idea, no? So mas maganda yung makikita mo talaga yung taba na inaalis mo.
So in that sense, Doc, although conceptually it's the same, the procedure hindi pareho dahil nga mas kailangan mo maging mas maingat kasi sa mata na yan eh. Meron ka you have to have a delicate hand when it comes to removing anything that has to be close to the eyes. Kasi you're trying to preserve vision mo. At the same time, it just so happens na merong extra fat that we're trying to get rid of. And then, Doc,
Right.
Yung sa pagkaka-explain mo kasi, there's ptosis and there is yung there's ptosis or you have blepharitis when it comes to the skin. Tama yun, Doc? So, paano mo i-confirm kung sasabihin ng patient, Doc, tingin ko ptosis to? Or paano yun na-determine whether the patient has blepharitis or kung true ptosis talaga yung condition niya?
Actually kasi blepharitis is like an infection around the eye.
Mm-hmm.
And actually the two can be related. Especially if you have a lot of excess skin out here.
Mm-hmm.
When the skin folds down, sometimes you can get some irritation because the tears would drain this way and the area is always wet. And so sometimes you can have an infection going on there on the side of the eyelid.
Oh, okay.
So the two can be related. And we've had patients before who had recurrent infections out here on the side. And after we removed the excess skin, they didn't have any infection anymore. No?
Oh, okay.
So these may be related. Sometimes it's not just a blepharitis case, but it might be also related to the excess skin, no? And so,
So in that case, Doc, parang magandang bagay talaga yung you're able to do things in stages. Kasi in that case, sa describe nyo, may infection siya lagi at the same time nagdo-droop yung eyelid niya. At dahil inuna nyo, sige, alam mo yung drooping eyelid, i-resolve muna natin. And then as a result of that, you're also able to solve the problem of the recurring infection. So by doing it in stages, okay, yun pala yung dahilan nun. So that's why it was important to do the first step first instead of, hindi, gusto ko paayusin lahat or continuous na ako magagamot, parang ina-accept nila as part of life that maybe I'm that type of person na madalas na talaga magka-eye infection.
Yeah, well, sometimes there's really a cause for it. No? I mean, of course, we start being conservative with staying on the conservative side. We treat the infection first. Pero kung paulit-ulit naman yung infection, then there might be a reason for that. And the removal of the excess skin will also help heal that infection. No? So it's very important to undergo a proper eye examination with proper eye specialist.
And then, Doc, speaking of yung having a good comprehensive eye exam, no? Ano yung ginagawa during the checkup? And then are there certain tests that you do that are siguro an add-on when you're trying to diagnose a patient with eyelid condition?
Well, of course, the basic eye examination is very important. the function of the eye, the vision, the movement,
Mm-hmm.
and looking the pressure of the eye, looking inside the eye just to check, make sure everything's okay. Then in addition to that, we make the measurements, how wide open are your eyes, the function of the muscle,
Mm-hmm.
sometimes something to do with the tearing to see if there's proper lubrication. So these are added tests also that depending on your condition that we can do, but it's best to do it in the clinic setting. No?
Mm-hmm.
Teleconsult is also good, okay, for things that we can see externally. We can always do a teleconsult for that. No?
Mm-hmm.
But anytime we need to have the eye tested for the vision, for the pressure, things like that, then
Oo.
you really need to come into the clinic to have a proper eye examination.
Mm-mm. So siguro when it comes to, at least now, during the pandemic, I'm sure maraming tao kasi na medyo nag-aalala about going to a clinic initially. So you're saying that, lalo na for ito, so sasabihin ng patient, alam mo, nararamdaman ko parang yung nagdo-droop yung eyelid. Pero hindi sila sigurado. Or hindi nila alam kung yung drooping ng eyelid nila has something to do yung lagi siyang nagkaka-irritation or parang lagi niyang kailangan nag-eye drops. So at least, kapag nag-schedule sila ng teleconsultation with you, you're able to assess initially kung what looks like the problem. And at the same time, masasabi niyo to kung, sige, alam mo, based on sa nararamdaman mo, it's time to actually come for in-clinic consultation. So at least, again, the beauty of it is step-by-step siya. You're only coming to the clinic because there's a reason to na. You're not going, unnecessary. It's not a non-essential travel in that case. It is already with doctor's advice na based dun sa nararamdaman ng patient, mas maganda, mas mainam, at mas napapanahon na magpa-check up ka na sa clinic. And in this case, in the case kapag sa Asian Eye naman siya pupunta, mabibigyan naman siya ng certification, an appointment slip. So even if they have to travel out, mapapansin siya at any checkpoint. Meron siyang, a piece of paper to signify na yes, they're coming for a checkup. May dahilan talaga yung pag-travel nila. And, it's done by appointment. So merong a little bit more peace of mind and meron tayong magiging plan, a treatment plan for whatever their condition is.
Right. So, for patients who have problems with mobility, for patients who are in far-flung areas, and it would take them a lot of effort in order to come to the clinic. A teleconsult initially is a very good thing because at least then we would have an idea of what the problem is and we can advise the patient, yes, it's really necessary for you to come in para hindi naman masayang yung kanilang pagod in order to come here. No?
Mm-hmm.
So yeah, I think teleconsult is a very good thing that is slowly being developed now and becoming more and more popular. No? But like I said, there are certain things that cannot be done during the teleconsult, and if you need those types of consultation, then the clinic setting is still always better.
Mm-hmm. And then, Doc, siguro, let's say, if I were a patient and then I decided to do a teleconsult with, sabihin ko, alam mo, parang napapansin ko kasi recently with the way that I'm working from home, na parang may problem na ako, maybe with eye bags. Like, I hear a lot of people talking about how even working from home has actually become more stressful. Some of them feel like it has taken a toll. Parang ang apektado. Yung itsura nila mas mukhang haggard. Parang mas kumapal yung eye bags nila. Is something like eye bags related to just fat? Kasi sasabi do, diba, all eyes, meron siyang fat surrounding to cushion it para, kumbaga, to keep it in place. Na taon lang na habang tumatanda, nagmo-move down siya. Kumbaga, nadidislodge siya from where it's supposed to be. Pero yung eye bags pa, meron rin kinalaman doon. Una, sa puyat. At saka second, maybe with the kinds of food that you're eating, the diet that you have while you're working from home.
Yeah, I think all these are related because the diet would also affect the type of skin and, kung lagi kang puyat and you don't have the healthy habits, you need your rest also, no? Kung lagi kang puyat at hindi ka nakakapahinga, then it affects your health in general, and it could also affect your appearance. Okay, so yes, all these things are factors that sa unang tingin parang baka hindi naman talaga ganun ka-importante, pero actually in the long run, it takes its toll also, no? So generally, all those healthy habits about good diet, good sleep, rest, etc., they all help, no? And well, as far as being in the house all day is also sometimes not that healthy either, no?
Uh-uh.
So to get out once in a while, maybe exercise, do a little walking around. I think that helps your frame of mind as well, no? Your psychological frame of mind also.
Kasi all that really does affect.
You get some fresh air also once in a while.
Oo. Kasi kung ano nararamdaman mo siguro doon on the inside, it does in fact reflect on your outside. So if you're taking care of yourself well, but you do notice na parang there's something sa mga mata ko, lagi ang pagod, then maybe it's a good reason to also come in for a checkup. And then siguro, Doc, speaking of habits siguro that we developed during maybe this work from home period, this pandemic, or habits that you've developed over the years, how about things like if someone is a smoker, is that a habit that could affect, the way that your eyes look or the function of them?
Yes, actually, smoking also is a habit that has been proven to take its toll also. No? You can see in the quality of the skin and the general appearance of the person overall. Smokers usually always look a little bit older than non-smokers. No, in general, I'm not saying in specifics, no, but in general, it does take its toll eventually on your health.
Okay. So yun, at least siguro that's another thing for our viewers siguro to remember na sa panahon ngayon, mahalaga sa atin yung health natin. You want to be eating right, gusto mo, hindi mo na lumalabas. So kung meron kang other habits that would be good to develop, so yun, wag natin masyado siguro kinakamat ang mata. If you can lessen or completely remove the habit of smoking, might as well. Kasi yun nakaka-affect sa itsura ng mata mo, sa itsura ng balat mo, and of course, overall health. And as you were saying, Doc, when it comes to mental health, having a little bit of activity, malaking bagay yon when it comes to not only your general wellness and fitness, it also affects your mental health. And at the same time, kung anong pagod, puyat, or all those things that you're feeling, it will in fact show on your face. And it also shows on your eyes, di ba? Kasi bad diet, all that, it will start to reflect after some time. Then siguro, Doc, if there's a patient, maybe they're coming from the province, gusto nilang magpa-teleconsult with you. What are things that they need to prepare just so that, they're able to make the most out of the teleconsultation?
Well, they would need to well, I guess they would need to know what the real complaint is. If they will be able to describe what they're feeling, and maybe prepare what kinds of medications they have taken for it. If they have any laboratory tests done recently, then they can also show that to us.
Okay.
Sometimes some scans or things like that can also be helpful.
Okay. So those are just some things that we need to keep in mind when we're trying to get a teleconsultation. Doc, we also have some questions from our viewers. So first from Tere Haregi Ramos. Doc, is it true that hereditary ang ptosis?
There are certain types of ptosis that may be hereditary. Okay, and these are usually the congenital ones, no? Yung mga inborn na ptosis, they can be hereditary in nature, no? But most of the ptosis that we see from aging, these are called acquired ptosis.
Mm-hmm.
And they're usually not hereditary in nature. What can be inherited maybe is the predisposition to developing the ptosis. No?
Mm-hmm. So in that case, Doc, kung meron ka lang, kapag nakikita mo kung paano nag-age yung parents or grandparents mo, it's a clue, more or less, on how you will be later on in life. So, sign yun sa'yo na kapag it runs in your family, ipacheck mo na.
Yes.
Mm-hmm. And then, Doc, the next question naman is from Lita Diaz. Pwede bang ang eyelid reduction and eyebag surgery at the same time? So in this case, you mentioned it, Doc, na usually you do eyelids first, and then we'll see how you're recovering, and then we can do the eyebag surgery afterwards, just so that, we're able to make sure that you're recovering well.
Okay. So for the ptosis or for the drooping, if it is the real ptosis that we have to do muscle surgery on, then I usually don't advise doing it together with the lower lids.
Mm-hmm.
But if it is just a plain removal of skin in the upper lids, then we can do the upper and the lower at the same time.
Mm-hmm. So in that case, Doc, it matters that they come in for the consultation so that you can tell them kung pwede bang magsabay or dapat hiwalay siya.
Oo.
And then the next question naman.
Sinusukat kasi yan eh.
Ayun, oo, yung pagsusukat niya nga, Doc, that's the thing that will likely take time and we have to be particular about. And then, Doc, here, this is a good question, I think, from Pinky Hernandez. Does ptosis cause headaches?
Does ptosis cause headaches?
Mm-hmm.
Well, there's probably not a direct relationship with the ptosis and the headache, but there might be some relation to that also, no? Because if the if the ptosis is really bad and covering the eyes most of the time, then sometimes it can cause some eye strain as well, and that may be the cause of the headache.
Mm-hmm. Mm-hmm. So in that case, depende at posible. It's just that kailangan mo talaga ipa-check up then para we're able to determine kung related sila or if one is causing the other.
Right. But you see, headaches, there are so many different causes of headaches that sometimes we need to ask a lot of questions about what type of a headache you are experiencing, what time of the day does it occur,
Mm-hmm.
and we may even find a different cause for the headache, not really related to the ptosis.
Okay. So in that case, again, it matters na kapag kinausap mo yung doctor mo, you tell them your history and if there's any changes in your lifestyle siguro that could be contributing to it. Because the more information ang meron ng doctor mo, the better the diagnosis is typically. Kasi they're able to narrow down kung ano yung mga factors siguro that could be causing yung nararamdaman ninyo. And then, Doc, here's one question. What is the cause of eyelid itchiness?
Eyelid itchiness.
Mm-hmm.
Usually, if there's some itchiness of the eyelid, usually it is caused by some form of an allergy or allergic reaction.
Mm-hmm.
More often than not.
Okay. So in that case, Doc, is this something that is a matter of maybe using a specific product like a lid scrub of some sort to see kung yon will help resolve the problem?
Yes. For allergies, the best thing is still avoidance of what you're allergic to or the allergen. So if you can avoid getting exposed, for example, to the dust or maybe exposed to maybe the animal fur, things like that. No, whatever is causing your allergy, if you can avoid it, then that's still the best thing. But otherwise, maybe some allergic drops or eye drops or maybe sometimes some allergic cream around the eye that can also sometimes help.
Okay. And then another question naman, Doc, from Flor Tagulaw is, for my case, I have a black under eye bag And it started when I was in elementary. Is it hereditary po or normal? Or or can it affect my lifestyle? My age is now 36. So matagal niya ng condition yun, Doc. Parang very dark siguro yung eye bags niya ever since she was quite young.
Okay. Sometimes it depends, no? If the eye bags kasi are very big, then sometimes it casts a shadow, and minsan sasabihin na dark circles yan around the eye, pero actually it's just the shadow of the eye bag, no? And the possibility of dark circles around the eye is also some form of allergy. Okay, usually kids sometimes, no, when they have recurrent allergies, makikita mo you have these dark circles around the eye. So it could be some form of allergy also. And there's a difference between eye bag and actually discoloration of the skin. Kung talagang maitim yung skin mo, maybe a consultation with the dermatologist. Baka wala ka namang eye bag pero talagang medyo dark yung skin. Consultation maybe with the dermatologist might be needed.
Okay. So it depends. It's also a matter of narrowing down what it could possibly be. Going to see more than one kind of specialist para makita natin. Okay. Sure ako
Right.
hindi siya yung condition
You know,
na yun.
because that's the eye, you can always come to us and we can check on it, and then we can always direct you to the proper
Specialist.
doctor or specialist if necessary. Kung di naman namin kaya, di refer namin kayo dun sa karapat-dapat naman.
Okay. And then, Doc, we have a question from Aimee Huachon. This procedure, is it okay even for diabetics? So I think she's referring to Ptosis surgery or Blepharoplasty. Is it safe for a person that is diabetic?
Okay, so before we do any of these procedures, we always ask for a clearance. And if you're diabetic, we would even, well, ang pinaka-basic kasi dyan is a clearance from a cardiologist, no? If you're anywhere like 35, 40 years old or older, we always routinely ask for a clearance from the cardiologist. Now, if you're diabetic or have any other kind of comorbids, we also ask for a clearance from your endocrinologist, no? Kunyari, meron kang thyroid, we will ask for a clearance from your endocrinologist din, no? Kung diabetic ka, endocrinologist din, no? Kung meron kang kidney problem, we'll ask for a clearance from your kidney doctor, no? Your nephrologist. So all these things, before we proceed, we want to make sure na you're in your kaya naman ng katawan ninyo, no?
To undergo the procedure.
Right, before we undergo a procedure. Because kahit papano, kahit outpatient surgery to, operasyon pa rin yan, di ba?
Yes.
So, kailangan maingat tayo.
Okay.
And yung body mo, for it to heal properly, has to be in good condition. Dapat nasa malusog na kalagayan yung katawan mo. Para naman yung healing madali lang. So, like, diabetics are a little bit prone to a little bit prolonged infection, prolonged healing, no? Minsan matagal bago mag-heal. But that's usually if their blood sugar is uncontrolled. So, bago ka mag-undergo ng surgery, yung endocrinologist mo will treat you first para bumaba naman yung blood sugar mo. Bumaba na siya at cleared ka na, pwede ka na magpa-opera para mabilis gumaling yung sugat mo.
Okay.
In some cases, we can always keep the stitches in a little bit longer. Pag sigurado na tayo healed yan, saka natin alisin yung
Okay, so in that case, meron palang techniques to at least make it safe for diabetic patients or any patient that happens to have some comorbidities. Ito, Doc, there's one interesting question naman from Zale Joy Lunar. Can bulging of the eyes because of thyroid eye disease be treated or operated on?
Yes, actually, bulging eyes, okay, they can be treated, no? There's actually a whole series of operations because thyroid eye disease affects all the different tissues around the eye. It affects the eyelids, the muscles, the fat, and sometimes even everything gets swollen and inflamed. No, so there's a whole different there's a whole set or series of treatments that can be done for thyroid eye disease. No, so depending on which stage you are, um, there's something that can be done. No, whether uh, whether you if you're in the acute stage, then we usually give some medications first. No, if you're in the chronic stage already, and you'd want to have your appearance improved,
Mhm.
then certainly come pay us a visit, and we can assess your case, and we can decide what are the things we can recommend to you. No,
Okay.
kasi especially with thyroid patients, one patient is not the same as the other patient.
It
One
really
is
depends on your unique
very
situation.
different case is very different.
Mm-mm. And then here, Doc, this another question from Joy Dumlao. Doc, does ptosis cause dramatic increase of myopia? The patient is a 9-year-old child.
Okay. What we did not mention here is that in children, if the patient has ptosis, then sometimes it can cause astigmatism.
Okay.
Usually astigmatism ang problem dyan, no? But myopia, usually, not specifically myopia, but what we usually see more often is the astigmatism.
Okay.
And if they do have ptosis, children who have ptosis really need to see the eye doctor, okay?
Mhm.
Because especially if one gets occluded compared to the other, pwede ka magkaroon ng lazy eye dyan. Oo. So, because the kid will favor one eye more than the other, and then magde-develop yung paningin dun sa natakpan na mata. So yan, kailangan talagang as early as possible makita na matingnan na siya ng eye specialist, no, na pediatric ophthalmologist or even oculoplastic, no.
Mhm. Okay. So in that case, siguro that's one particular case that it's very important that you either you can initially actually do a teleconsult siguro with you, doc, or a pediatric ophthalmologist. Lalo na at any point, usually if the quarantine restrictions, let's say they return, then that's one option for them. And the second would be to really just request for a checkup at the clinic. Um, so in that case, actually, on the upside, we do have a World Health Day promotion when it comes to a teleconsultation. So let's say you want to talk to Dr. Kleiner, meron kayong karamdaman na gustong ikonsulta sa kanya. Yung maganda kasi for this month, we're celebrating World Health Day. So that means that we have our teleconsultations available for only 400 pesos, and that's a promo that runs until April 30. Right up until the end of the month, so right up until the end of our quarantine, I think, the current quarantine condition that we have. And then I think that was the last question that we had from the viewers that we have for today. And then siguro yung the thing to keep in mind na lang for patients is if you do want to do a teleconsultation with us, just prepare yung sinabi nito, kung meron kang medication na tinitake, ano ba yung symptoms na nararamdaman mo, at ano ba yung specific na tanong na gusto mo itanong kay doc. When you have those things ready with you and you start the teleconsultation, it's much easier. Kasi minsan kapag nagpapakonsulta tayo, nakakalimutan natin yung mga gusto natin itanong. So list them down. It will just be a much easier thing to do, whether you write it on a piece of paper or you put it on your phone. And then, syempre, basta't may internet connection tayo, may smartphone ka or your laptop, and of course, some good lighting. Kasi minsan, when you do the teleconsultation to the doctor, they do need you to be seen very clearly during sa video call para pwede namang ma-assess niya. And in the case of Dr. Klein, he can see it eh. Kung nagdo-droop nga ba talaga yung eyelid mo, and then masasabi niya agad sa'yo kung kailangan mo na magpa-in-clinic checkup. And then, Doc, if they wanted to actually come to the clinic to see you, sa anong araw ka na available in our Asian Eye locations?
I'm in Rockwell on Monday and Thursday, in Trinoma on Tuesday, Alabang on Wednesday, and Mall of Asia on Saturday.
On the upside, when it comes to Dr. Kleiner, he's available in a lot of our clinics. So kung depende na lang sa anong area ka nang gagaling. And for those that want to try our the teleconsultation service, you can set an appointment through our hotlines. So it's at 8898-2020 or through mobile at 0917-800-9103. And if in fact you need eyewear, you need to replenish your eye meds, let's say nagpakonsulta ka kay doc at sinabihan niya kayo na kailangan mo ng eye drops or certain eye meds, you can actually shop safely and conveniently via asianeyeshop.com. We've made your eye care and eye meds needs available, including frames for kids and adults. You can get sunglasses, especially now that it's summer. We also have contact lenses, sports eyewear. So let's say you're maybe a cyclist or some sort of outdoor sportsman, you might as well have good eye protection. Lalo na, mas mainit ngayon. Ngayon ang panahon because of the summer. We also have PPE, like goggles and face shields, as well as accessories like Zeiss lens wipes or eyeglass cords. Kasi sa panahon ngayon, Doc, like you were saying, naka-mask tayo, naka-face shield. And sometimes, kung nakasalamin ka pa, it's good to kind of have a cord to keep your glasses in place so that you're not touching the frames. You might accidentally scratch your eyes. Yung mga hindi natin iisip eh. Those are the habits we're trying to adjust, especially now that, keeping your hands clean, washing your hands, sanitizing, and, keeping your distance from people is very important. And then Asian Eye Shop, just for everyone to know, is that we ship nationwide, and we also have a couple of promos. First is we can have free shipping for purchases over 2,000 pesos. We also have a free upgrade to UV plus blue light lenses for daily specs and kids specs frames. So whether yung salamin na gusto mong bilhin is for an adult, for yourself, or for your children, may free upgrade na tayo so that you're protected from both UV rays of the sun as well as the blue light coming from your gadgets. We also have a buy one and take 50% off on sunglasses. So if you're looking, you're the one that handles errands when you're going to the grocery, or let's say you're the one that handles trips to doctors, right? You still get exposed to the sun, even if you're going to take a walk to the store. So might as well get a good pair of sunglasses. We also have some electronic GCs, so you can try our services at discounted rates. So the first, of course, you can get a teleconsultation for only 400 pesos. We also have family eye care package. So that includes a comprehensive eye exam for 2 adults and 2 kids for only 5,840. So let's say you wanna do it in one go. The parents and the kids get a whole checkup as a family. It becomes much more convenient, and in this case, a little bit cheaper. And then we also have the LASIK buddy package. For some people, they don't want to wear eyeglasses anymore. Inconvenient siya when you're wearing a face shield. So you can get 2 LASIK screenings for only 4,000 pesos. So that's a significant reduction from our normal rates. Of course, other conditions that other people may have. If you think you have glaucoma, then we can have glaucoma screening for only 6,795, and cataract screening for only 3,510. So in this case, like Dr. Kleiner was saying, sometimes your condition is that you might have cataract. We need to be able to treat that first, and then maybe later on, if we find na meron kang ptosis, maybe there's some drooping you're worried about, maybe even eye bags, then at least your screening is done, you get the surgery, and then we can do the plan for your other eye care needs. And then, Doc, you know what? Thank you so much for taking time from your schedule today to talk with us and to talk to our Facebook Live viewers. I'm sure a lot of the viewers have learned a lot from you and about the case of having droopy eyelids. And thank you also to their viewers for always joining with us. So again, this is Audrey. Until our next Ask Your Asian Eye Doctor Facebook Live session, please take care of yourselves. So stay safe, remember to wash your hands, and practice social distancing. And most importantly, wear your mask properly. So any last words from you, Doc? Any tips for our viewers?
I just want to thank everybody for tuning in to listen, even for a short time. And also for those who ask questions, we thank you also for actively participating dito sa session natin. So maraming salamat talaga sa inyong lahat. And we'll see you again soon. Bye.
Bye. Thank you, everyone.